Hi, everybody. One more here. Wisconsin 4th Congressional District Congresswoman. So proud to be here. I wanted to convene this conversation so that we could talk about the possibility of a healthcare shutdown and some of the dynamics that are playing into that imminent threat. Last Friday, the House of Representatives passed the GOP's continuing resolution, which included no provisions in it to extend the Affordable Care Act premiums, tax credits. And of course, it did nothing to ameliorate the devastating $1 trillion cuts in Medicaid, nor to address the $500 billion threat because of the Budget Control Act of cuts in Medicare. So those provisions did not address healthcare, and Democrats had made addressing the healthcare concerns kind of a red line, a bottom line for supporting any provisions um, uh, for supporting the bill. And of course, the Republicans are in the majority. And what we have seen is that they are, even no matter how awful the bill is, they are able to convince their members to vote for it. And so they have the capacity in the House to pass the bill, and they passed it. It went over to the Senate, and the Senate had a version of a continuing resolution that actually did address the Affordable Care Act premium expirations, and that bill failed. And of course, in the Senate, there is a filibuster rule. It's not a law, but it's a rule that you need 60 votes in order to bring the bill up for actual passage. The Democratic version of the bill, which extended the Affordable Act credits, was defeated, as well as the Republicans' version of the bill, the House version of the bill, which was defeated. Subsequent to that, Chuck Schumer, minority leader in the Senate, and Hakeem Jeffries, the leader, Democratic leader, called the White House and made an appointment with President Donald Trump to try to come to some sort of agreement or consensus around healthcare. It is absolutely catastrophic, as we see it, to allow a continuing resolution to pass when premiums for all healthcare open enrollment period is happening in November 1st. That being said, it would be too late to prevent premiums for the Affordable Care Act from going up by a minimum of 75%. What we're looking at is somewhere at least $800 a year more for a premium. So you divide that by 12 months, somebody do the math. It is a substantial amount of money to expect someone to be paying on a premium. And so the consequences of that is that many people would lose their health care. What we've learned, as is the case in Milwaukee, is that the Affordable Care Act, the expansion in Milwaukee and our areas, disproportionately had an impact on people in Milwaukee and people who were low income, who have relied on the Affordable Care Act in order to have any health care. We also realized that $1 trillion cut, over $1 trillion cut in Medicaid is catastrophic for the entire healthcare system. You know, not just rural hospitals, but hospitals in general would lose about $25 billion a year due to uncompensated care. And Medicaid is it's a house of cards, because unlike what people may think, Most of the expenditure from Medicaid are not little snotty-nosed children that show up in the emergency room. No, 46% of Medicaid is spent on nursing homes, our seniors who are in nursing homes. That, of course, is a mandatory benefit that has to be paid for. So that means that a lot of stuff is on the chopping block for Medicaid payments. Community health centers. We know that they've cut out any care for Planned Parenthood, which is often, the first recourse any woman has. I mean, I had my first reproductive exam at Planned Parenthood when I was 18 years old. And getting rides to dialysis, any numbers of programs that are being put on to feed people that are supported by Medicaid funding are at risk. And you can't just take $1 trillion out of the healthcare rubric and say that everybody will be okay. Which also means, I mean, there are people who think it doesn't affect them, but those people who work for agencies or institutions that provide health care, their employers will be negotiating new rates come December, open enrollment period. And people who get insurance through their employers may find their portion of the insurance going up. And so what we're going to see is an explosion of costs for people to retain health care. And if people can't afford it, they'll simply drop off. And Republicans have been very, very clear about their goals, that they want people to drop off. Their claim is that there are a lot of people who don't really need health care, that they are just idle young men in basements playing video games, and that somehow there's a whole population of people that don't need it. Well, in Wisconsin, we have 276,000 people that we know of that will be directly impacted by the loss of the combination of the affordable health care as well as Medicaid. And we think that there are not that many boys in the basement playing video games that are relying on health care in Milwaukee. I do think that it would be a shame to see a government shutdown. We are hoping that the president would take up our offer to visit with the leadership and to allow Democrats to have some say. Some of our constituents are very, very dependent upon on these provisions. Again, more than 22 million Americans depend on the Affordable Care Act, and 276,000 of them are from Wisconsin. That a combination of Medicaid and the ACA. 93% of the people who sign up for the marketplace actually get some kind of subsidy because they are people in need. These tax credits saved working people a lot of money. And on average, they save $705 annually, but we're adding that back in. And we think about 4 million of these folks, because of the actions or inaction on the Affordable Care Act premiums, about 4 million people nationwide will just not be able to afford it. Democrats in both the House and the Senate have put together a package that would permanently extend the premium tax credits, and we're just waiting on them to at least have a meeting about it. They've canceled meetings, so we're questioning whether there's any good faith at all involved.